Good morning, my name is Jennifer Crow, and this is my presentation on Alzheimer's disease. The Alzheimer's Association estimates that 5.5 million Americans over the age of 65 suffer from Alzheimer's disease in the United States. Just a couple more statistics about Alzheimer's disease. 1 in 10 people over the age of 65 will be diagnosed with Alzheimer's. That increases to 1 in 3 at 85. You've got 200,000 individuals less than 65 diagnosed. And us Texans, you're going to have about 380,000 people. So what is Alzheimer's disease? Alzheimer's disease is going to be the progressive and irreversible brain disorder that involves the decrease of your physical, your cognitive, and your behavioral ability that honestly is going to impact daily life. Now, dementia is actually going to be a group of thinking and social symptoms that will impact daily life. So the best analogy I can give for you is going to be a heart attack and chest pain. So a heart attack, a myocardial infarction, one of the symptoms may be chest pain, but just because you're having chest pain doesn't mean you're having a heart attack. There's other diseases associated with the symptoms of chest pain. Now with Alzheimer's, it's going to be the same way. Alzheimer's, one of the symptoms is going to be dementia. It's not the only cause of dementia, although 80% of the people with dementia is going to be directly related to Alzheimer's disease. The next biggest is going to be vascular dementia. These are going to be your stroke patients, your people that have decreased oxygenation to the brain. And these are a couple other causes and disease processes causing dementia. So what are the symptoms of Alzheimer's? With Alzheimer's, you're going to note short-term memory loss, maybe some long-term memory loss, confusion. These people may get agitated. They may have difficulties finding the words that they're trying to articulate. They may have difficulties remembering a person, figuring out their name. These symptoms are actually going to increase as the Alzheimer's progresses. So diagnosis, now your primary care physician or your neurologist does a couple things to diagnose people. First, they'll take a medical history. They'll kind of figure out the history of that patient. They may do some memory and thinking tests. They may talk to the family. You can do some laboratory testing just to make sure this is not like a B12 deficiency or potentially a thyroid problem. There are some images like CTs, PET scans, and MRIs. These are pictures of the brain that shows potentially shrinkage or just the activity in the brain. Now, the only definitive answer is going to be an autopsy after death. This is going to be your normal brain, and over here you're going to see your demented brain. You're going to see these big sulci and smaller gyro in comparison to your normal brain. Also, a couple other differences. Your normal brain is going to have a normal size hippocampus. It's going to shrink with your Alzheimer's brain. You're also going to see that these ventricles are going to enlarge, they're going to swell, and of course that brain's going to shrink. So types of Alzheimer's. First, you've got familiar Alzheimer's, which is your early onset. This is going to be your hereditary Alzheimer's. This is less than 5%, honestly. Your mutant genes are going to be your APP, your pre-senile1, which is the most common, and your pre-senile1-2. Most of the time, the early onset is going to be seen at 30s, 40s, 50s, and then your later onset hereditary is going to be an APO4 allele. That's going to be on the chromosome 16. Chromosome 19 is going to be an abnormality. But honestly, most of the time, Alzheimer's is going to be sporadic. That's going to be 90% of your Alzheimer's population, and it's usually more prevalent after the age of 65. Alzheimer's does affect both sex equally, although you may note a couple more females have Alzheimer's, but that's due to living longer than the typical male. So normal versus abnormal. Here you've got a normal, healthy brain with happy neurons. Over here, we're going to start talking about the plaques and the neurofibril tangles that causes some of these Alzheimer's symptoms. So these plaques, this is going to be insoluble peptide deposits of your amyloid beta. Now, amyloid beta is normally occurring, but typically it's balanced. So typically it produces and gets eliminated. In these Alzheimer's patients, they're going to be an imbalance. There's going to be an overproduction. They're formed by the amyloid precursor protein, which is cleaved by two enzymes. They're going to fold up on each other because their sticky ends are on the outside instead of the inside like a normal protein. The microglials, or the immune systems, are going to help clear out those amyloid beta, but in the time when those amyloid betas take over, they will cause an inflammatory kinases, and at that point they're going to start decreasing and causing a cascading effect and injuring those synapses. So here is your amyloid beta building up. So we're talking about this synaptic cleft. Right here is where your plaque is going to start building up, and as long as there's small plaque, your microglials can just clear it away. But when there becomes a lot, there's going to be an inflammatory response, and your microglials are also going to start degrading this area. So another protein is tau, and it causes the tangles. In a normal healthy neuron, in the microtubules, you've got tau right here, and tau is actually going to be stabilizing the microtubules. But in your diseased neuron that has Alzheimer's disease, these are going to phosphorylate. They're going to actually have an awkward shape. That awkward shape is going to make them stick together, forming these tangles, and you can see how the degradation of the microtubules start, which will cause the degeneration of the neuron. So, molecular medicine treatments. Currently, there's no cure. We're only treating the symptoms of Alzheimer's. My suggestion would be to be targeting that amyloid beta by reducing the chances of plaque buildup. If you reduce the chances of the plaque buildup, you reduce the chances of that cascading effect. They are trying to do this. They've got the amyloid beta cascading hypothesis, but it just hasn't completely developed yet. And these are my citations. And that's going to be the end of this presentation. Feel free to ask any questions.